All right, let's get started. My name is Andy Miller. I'm editor and CEO of Georgia Health News. And this session is about something striking that has happened in the Atlanta Regional hospital systems. I was told early on in the pandemic that the CEOs and chief medical officers and others that are with the various healthcare systems here were collaborating in terms of fighting the pandemic, and that this was pretty striking, the fact that these conversations were taking place. And so I am joined by three distinguished CEOs of three distinguished health systems that were a part of this conversation or a series of conversations. John Haupert is CEO and president of Grady Health System, Grady Memorial Hospital. And John's been there since 2011, which in Grady years is an awful long time, I have to say. Candace Saunders is CEO and president of Wellstar Health System. They have 11 hospitals and a number of health parks. And Candace has been with Wellstar since 2007. And we have Carol Burrell, who is with Northeast Georgia Health System, which is based in Gainesville. They have 4 hospitals and many outpatient centers as well. And all three of these people have been participating in these conversations. So, John, let's start with you. How did these conversations about COVID come about?
Well, early on when we first became aware of COVID, and we began to understand that we were receiving patients in the metropolitan area. Am I echoing?
Yeah, I got a little bit back up, but keep going if you can.
Okay, we'll keep going. When we began to get first patients in early March, the CMOs, the chief medical officers of all of the local health systems, scheduled a call to talk about what they were seeing, what their capacity was, what ideas they had about establishing dedicated units for COVID patients, because to be honest, we didn't know where it was headed. We didn't know what to expect early on as far as volumes. We didn't know what to expect clinically. And so the chief medical officers began that discussion. That was soon followed by calls we had as CEOs, both one facilitated on a regular basis with the governor. The governor set up regular calls with us with the CEOs of the local health systems within the Atlanta metro area to talk also about the status.
So I know that your 3 systems participated. I know that Children's Healthcare, Emory Healthcare, as well as Piedmont Healthcare were all kind of sharing information. Candace, what struck you as this dialogue took place in the early days of the pandemic?
I think you're muted, Candace.
Yeah.
I think that was to me, Andy, on it was how collegial the conversations were. You know, everyone, we were all looking for answers because we were getting a lot of, our teams were looking for answers from us. So it provided a safe place for us to talk about some of the things that we needed to address. And it was so reassuring to have our colleagues. And we sorted through it together, and we decided if we went out together that it would be helpful to really provide confidence and hope to our teams that we were leading.
And Carol, you joined these conversations. Was it illuminating for you as well in your health system?
I think, we talk regularly, as CEOs about either through GHA or, one-on, depending on, what the particular topics might be. But, like Candace said, I think what was, reassuring is that we were all in this together, and, trying to learn from each other. But the other thing that I would add is that, one-on-one, we would think of, Candace, or Candace would think of me, and we would call each other just to check in, because we all were impacted at different times in different ways. And so, that was illuminating, to use your word, and certainly reassuring.
John, why don't you address what kind of topics came up on these calls? I mean, early on, we didn't know a whole lot about the coronavirus, and B, how to treat people with it. So tell me about what the topics that you all shared.
So on the chief medical officer's calls, very much focused on what the different hospitals were seeing clinically. What kind of complications were they seeing among these patients? What percentage were requiring critical care services or ICU services? And as we progressed, what therapeutics and or pharmaceutical interventions were assisting or helping in the process. So lots of conversation around clinical best practice, what we were hearing nationally, how we translated that locally came through that venue. The CEOs were talking about not only that, but also availability of PPE became a quick subject that we talked about. As I've shared with Andy before, hospitals long ago moved to just-in-time inventory systems, and under that type of system, you don't have stockpiles of anything. And so PPE was one of those we didn't. And so we were all scrambling at first on our own, and then came together to determine how we could help one another. And if one system had a shortage and another had the item, then we could assist each other with those items. We also talked about employee issues. What kind of stress was this new virus having on our staff's morale? And as we got further into the pandemic and the economic impact came to many people, how were we going to assist our staff with how they and their families were impacted, either through loss of jobs? How did we decrease the fear among our employees of taking COVID home to their loved ones? And so it ran a long range.
Candace, I know that PPE was a big issue for every provider, and it may in fact still be an issue. Tell us about those early days and what the concerns about the supply were all about.
Well, I think to John's earlier point, one of the things that not only was it the local connection and collegiality, but also we serve on the national AHA, the American Hospital Association, as well as we work very closely with the Georgia Hospital Association. And then Carol and I also participate in the Vizient board. And those relationships became so important as we got into this whole personal protective equipment. There were shortages. Our number one requirement was to ensure that our team members had the safe environment to take care of the patients. And we had to, we were still in this emerging situation, to John's point, and we were learning as we were going. There was also conflicting information coming from the federal agencies. So we would talk to each other to try to sort through what the CDC guidelines, what we were hearing from different groups on how best to approach this with our teams, because we knew that unified approach was going to be important as we looked at our team member safety as our top priority right there with our patients. So trying to make sure that we had the mask and the different protective equipment, and then dealing with the team member concerns that many of them wanted to be overprotected, if you will, based on the guidelines, but then we were also facing these shortages. So it's that, meeting the team member where they're at to ensure that we're, giving them all of their, getting all their needs met while you're still dealing with these shortages of supplies. And so it was a night and day effort. We would work with each other, and if John would find a supplier or Carol would find something, we would, try to connect with them. But having these relationships at the national and the state and local level, And then we just had to pull out all stops. We were looking everywhere to ensure that we set up as many channels as we could to get the necessary equipment. The other thing that I think was important is our local communities also needed this protective equipment. Our nursing homes, our other types of health facilities, our first responders, our public health workers. So we all of a sudden were in a position where we had to get very connected to them so that we could ensure that we were helping them get this protective equipment while we were also getting that for our team members. And then it's continued to move forward, because then when the schools went back, when the different businesses started to open, we served as a subject matter expert role to help them with that.
Carol, what PPE concerns did you have early on?
I'm sorry, Andy, could you repeat that?
Yeah, I'm sure you had concerns about PPE early on as well. Did you find that these conversations among your colleagues was helpful?
Oh, absolutely. Just being able to have that network where we were all, canvassing any and all possibilities. And, as Candace pointed out, we were forwarding that information. I was able to, certainly, Phoebe being at the point of the spear and starting it all out, being in connection with Scott as they were moving through things. And then, of course, our local communities that really stepped up to the plate and started making masks. And we even had our poultry companies that were providing us isolation gowns and gloves. So it was an all-out team effort. And, we were looking at what our days on hand relative to the supply was, and, communicating that and trying to, again, look for all those sources.
I just would mention to that, we now have the ability to tell you everything we have on hand, okay, do every type of a protective, but we didn't have it at the beginning, but we do now. And the other thing I remember, Carol and John, we were actually sending patterns around for how to make masks, okay? One of the CEOs got a pattern from a local seamstress, and the next thing you know, we had that pattern, and we were, again, looking at all places to see who we could get to make masks. Carol and I were talking about that recently, because it was at that point we wanted to make sure to get as much supplies as possible.
I know that Phoebe. Go ahead, John.
It was really great to see the community come to the rescue of the healthcare organizations. A lot of industries use N95 masks, isolation masks. Home Depot, for example, is one of the biggest providers of N95 masks for construction work. So Home Depot was donating millions of N95 masks that they had in stock to the hospitals. The arts organizations in Atlanta all of a sudden found themselves shut down, but they had these costume shops that could manufacture masks. And so they were asking us, as Candace said, for the pattern and the fabric specifications to make the mask. The Home Builders Association came together because someone along the line in infection control figured out that Tyvek that goes on the side of houses was a great product with which to make isolation gowns. And we were running into shortages with isolation gowns. And so we then, around Grady, I know, and probably in Candace's hospitals, we had nurses who fell in love with these isolation gowns made out of Tyvek that had Tyvek across the chest and Home Depot across the front. But they worked beautifully. And if we hadn't had those kind of fill-in measures, we would have run out of some of these key items.
Well, I know Phoebe Putney was the epicenter early on in March of COVID here in the state. And I know that their community as well pitched in on sewing masks for the hospital. Yes. I think, and I was told that effort was shared pretty broadly, not just in Georgia. And I know that Jonathan Lewin at Emory also said that I think that they did a trade with Piedmont in terms of PPE, that one had more of one thing and the other had. So pretty amazing in terms of collaboration there. All right, so So based on this collaboration, how did hospitals and patients benefit through these dialogues among each other, among you all?
I would say that that having that consistent approach during a time of so much uncertainty, and we were all learning as we go, that having us come together, as John mentioned, we were working with the governor and his staff, Dr. Toomey at the Georgia Public Health, but then we had to manage also very closely with our local public health and our local, different municipalities. So having that aligned and consistent message for our patients, our families, and the public was important because everyone was looking for answers, as I mentioned, and we were always very forthright to say, this is what we know today. Okay, we are continuing to stay very much on top of it, but that I think was reassuring because they didn't hear a different message from Emory or a different message from Piedmont or Northeast Georgia or Grady. We were all looking to unify the message, even on visitation. It was a hard decision to go and have to limit visitation, but it was the right thing to do from a safety standpoint, and also as we were trying to limit the use of the PPE in our hospitals and that. So the fact that we came together and we set consistent approaches also helped send the right message, I believe, to the patient families and communities.
Carol, how did patients benefit in your system from your conversations and your medical officers' conversations?
Well, one of the things that we recognized kind of early on were some of our more vulnerable populations, particularly our Hispanic communities, especially with the poultry industry that we had. So I remember one of our critical care physicians within the early days saying, there's a lot of Hispanic here in ICU. And then that led us then in working with the state and our local public health department to really start working back with those agencies. And, there were other things that we identified, again, in those vulnerable populations that we were able to help not only our community, but be able to, communicate with others, because everybody's local community is a little bit different, but to share those things. And that community education and information sharing, we're very grounded in our community, very important partner, and we've always prided ourselves on that. But I'll tell you what, over these past few months, it's at an all new level, and the bond and the partnership is something that will definitely go down in history.
Yes.
John, you were going to say? You were about to
say. One of the things that we really benefited from in those conversations was understanding what the state's capacity was. We know Georgia Emergency Management exists. We participate with them, but we've never been called on to this level of a disaster statewide. And GEMA really stepped in with helping secure PPE for hospitals that were running short. DPH helped assimilate all of the conflicting news around best practice and/or protocols, and we could get standardized on that approach. And then we are fortunate in Atlanta, very fortunate to have the academic institutions that we have. And so a lot of the research that was emerging related to infectious disease was coming out of Atlanta, and we were able to share that information across the systems and share best clinical practice, even leading to our hospitals becoming one of the first groups of hospitals to trial remdesivir, and then emerge out of that with trialing remdesivir and steroids together, which we've all seen make a huge impact on the number of patients that require critical care.
So early on, there was not a lot known about how to treat these patients, but eventually through Emory and through other research and actual practice that y'all found out what to do to have the best outcomes, and sharing that information, I imagine, was very important.
Absolutely. It was like these daily calls were all about sharing what we were seeing. And when the first patient was ready to go home, be discharged, a lot of celebration on that. But the doctors and nurses were changing the approach just based on this constant interaction of what they saw that was working in the applied side. But then to John's point, we started to see some of the impact of some of our science come into this too, because we were very much learning as we go on this one, on that.
I know that there was also there was cooperation in terms of writing editorials, in terms of marketing messages. How did that come about, and what do you think the effect of that was?
I think back about when Carol gave me a call one time and she said, now Candace, what are you doing about, getting people to follow the parameters to decrease the spread? And we were brainstorming about that. She said, we just got to do something. I don't think they're taking it seriously. And part of it was because what we were seeing in Metro Atlanta and the surrounding markets had not, it was starting to come up into Northeast Georgia, but all of us were seeing some lag factor of when it really started seeing the higher volumes. So we came together and said, this is another area that we can share a common message, and we had to keep it simple. And so what we do, our slogan was the 3 W's. And so wash your hands, wear the face mask, and watch your distance and your time. But we really worked in public service messaging ways and getting that out to the community. So you start to know that you're planting the seeds, but then when they start playing it back to you, that's when you're saying, okay, now we're getting the word out. Because we knew, even though there was a lot of debate, a lot of different, opinions, welcome to, our wonderful country, that we knew that if people followed those things, that they would help us decrease the spread and try to level off the cases. The other thing that we learned was you have to tailor your message. And as Carol was mentioning, with our Hispanic population, with our African American population, you can't just say to go home and not in social distance. You have to really get in and meet them where they're at, from their language needs and from helping them with some of the social aspects of getting them to be best prepared to prevent the spread of the virus.
And so the joint message was effective in terms of letting people know, look, all these health systems are coming out with the same thing, correct, John, in terms of, what to do and what you guys think is necessary to stop the spread?
Now, we together, on numerous occasions together, formally published editorials, opinion pieces in the AJC. We even have a banner page that lists the 5 or 6 systems, these 3, Piedmont, Emory, and our 3W theme we have marketed in different publications with our labels on there. And Candace said it very well. We all have a tremendous responsibility to our communities to protect public health and to promote the health of the public and protect health. And we know that washing your hands and maintaining distance and wearing a mask are a way to get that done. So we did find ourselves oftentimes in these conversations having to have the political conversation around how in the heck did something like wearing a mask become so politicized? But we knew we had to stand up for the mask because it was the right thing to do for the public.
Carol, you mentioned reaching out to the Latino community. How did you go about doing that, and what are you still doing on that?
Well, there were a number of different avenues. Emory worked with us to help do some tracing. They provided some resources to help do tracing. We worked very closely with our local school systems and, dispersed out into the communities relationships that the teachers and the various counselors had in those communities. We really learned a lot about not only in the Hispanic, but also in the African American community, even here in Gainesville, that they're comfortable in their area of town. And we were really surprised to learn that they didn't even want to go a mile outside to the Department of Public Health to be tested. So we would go and support testing there. We have our Good News at Noon clinic here and really worked through them. There's still a lot of education that's going on. The local task force within the Hispanic and the African American communities. And of course, we're still working with the poultry industry, which I can't say enough about because they got hit hard and they really took it seriously and they were able to flatten that curve. So we're trying to take the lessons learned from them to the rest of our community now. As you know, we hit our real peak. We thought we hit our peak in May, but we really didn't hit it until August, and it was rough.
Yeah.
And so we've been fortunate to see it come down, and we're hoping that with school starting and after Labor Day that we're able to really, you know, go all out to all the community. So as time went on, it was more across the entire population that we were seeing. It really wasn't in a specific area as it was early on.
You know, Andy, it was interesting in the first, as Carol said, we thought we had a wave. We had a little wave in April, May, but at least in the population we served through Grady, we saw the majority of that first wave, the people being impacted being primarily people, African American and white. The second wave, we did begin to see this big peak even in the middle of Atlanta of Hispanic patients. And as Carol said, we fortunately have one of our neighborhood health centers on Buford Highway, and we began doing testing at all of our different neighborhood sites. And when we began doing testing at that site in that neighborhood, the positivity rate for several weeks was above 50%. And remember, the ideal positivity rate is supposed to be 5%. We were seeing 10 to 15% at our other sites around Atlanta. But in that site, 50% and above for weeks. And I think someone mentioned, it may have been Candace, that high capacity living environments were contributing a lot to that. And as Carol said, a lot of the work environments early on had not identified this as a risk, and the spread occurred rapidly.
Candace, has the messaging changed from your standpoint to the community as this pandemic has changed?
I think the messaging is very consistent, Andy, but I will say that our learning continues to mature here. In that at the beginning of the pandemic, when everyone was more sheltered in place, so you'd go to work, go home, go to work, go home. Our team members were not getting the virus, we're not needing to be quarantined as much. But then as we moved into, the businesses reopening, people going back to work, we found the next part of this big old tsunami wave was that we had a lot more of our team members getting the community exposure, not exposed at work, because we had all those state, but they were getting the community exposure. So we had a lot of team members that were out in quarantine, and that affected our staffing because you have your normal illnesses with your team, but then we had to make sure that they were quarantined until we knew they were ready to come back for work. So that was another learning of the impact of this community spread as people go back to work and get back into their lives. But it doesn't change the same, necessary actions to decrease the spread. We do believe there's very compelling evidence that it does help. And what we're learning more and more, though, is these other aspects of the ventilation of the rooms. That's why another thing with our at-risk communities, we have to look at ways that we can help them, reduce their exposure with some other approaches. And into what Carol said is that, and John and I have talked a lot about this in Atlanta, we actually have to go to their neighborhoods. We go to their churches and we meet them where they're at for the testing and to make sure they have the supplies of, the different, hand washing capabilities and wipes and that, and masking. Because if they don't have access to those different resources, then they're not going to be able to help reduce that spread. The other thing is many of them were challenged with food insecurity, even more so during this pandemic. And they were dealing with job losses and other, social needs. So we had to also really lift up our partnerships with our different community resources. And actually our nurses and our team members have gone out to volunteer to get food to these different individuals. So our role in the community has been not only as a subject matter expert, but also in helping and joining forces to help get them the nutrition, to get the resources they need to protect them and to reduce the spread.
As I said at the outset, the level of collaboration among health systems struck me and others as almost a surprise. After I've covered a lot of over the years, a lot of more competitive type of things among health systems. So, Carol, did it take a pandemic for this collaboration to happen?
I don't think it took the pandemic for the majority. I won't say for all, but for the majority. We work collaboratively, and we recognize the competition, and but I think for certainly the three of us, we recognize what our mission is. In improving the care in our communities, and how can we best do that? We've got to be financially solvent in order to do that. So there is a level of competition there. But, in thinking about this, I was reminded of a situation that we had last year where we had some major issues with our sterilization equipment and stuff in our OR, and there was no equipment that we could find. And Piedmont had one available for one of their hospitals that hadn't opened, so we were able to trade it out. So, there are things that we work on. I think the pandemic probably made it more visible to our communities than perhaps what they typically see, which is all the advertising and the chatter, if you will.
Right. John, you mentioned earlier with me the fact that when you had the pipe problem in Grady Memorial Hospital, that other hospitals stepped in and took those patients.
No, immediately. And that was December of 2019. We had a major internal disaster at Grady when a charged water line ruptured and dumped 50,000 gallons of water into the hospital and wiped out 220 of our beds. And those have just now begun to come online. And so we immediately went into a disaster mode and had about 80 patients that we needed to transfer out. And within a few days, there wasn't one of the health systems that didn't help us out, particularly those, and we started closer and worked our way out. And the same thing. And so, yes, everyone was incredibly helpful, and they have been the entire time that we have been 220 beds short. With helping with medical patients and redistributing patients around the metropolitan area to hospitals with capacity. So yes, that's been a big help.
Candace, along those lines, the pandemic seems to have brought about this collaboration, and I'm sure some of it must have been back when we had a lot of hospitalizations that that there was communication, at least with the state and probably with each other, correct?
Yeah, to your earlier point, we've always collaborated together, and we cooperate because I think we have a shared mission of improving the health of all Georgians, and that's kind of our common bond here when you look at our mission and our vision. Obviously, we think that we have really strong health care in Georgia, and we're proud of what the role we play. We know we're continuing to work on getting better. And so sometimes competition can help make things stronger, but then when you need to cooperate on that too. And so I think that we are much stronger in our relationships today and the communication. But to your point on the hospitalizations, and John and Carol can speak to this, it became critical that we were on the phone together, because when the peak of this in August, as we saw more of the community spread, we had situations where we were down to maybe single digit ICU beds. But because we were talking and working together and looking across not only the metro Atlanta area, but all of our markets in Georgia, and working cooperatively, we were able to get people to the right care. And sometimes we would move patients for a different level of care back to the community in order to get them to the ICU bed they needed. And I know Phoebe Putney will speak to this. During their peak time, they were moving patients all over Georgia and the region. So that communication and coordination, I believe, became paramount to making sure we got the right care at the right time for our community.
I know that, well, you know better than I that the flu season is coming up. We still have hundreds of positive cases of COVID reported every day. Are your thoughts that this collaboration will continue in the months ahead? John, you want to tackle that?
Sure, absolutely it will. We all track the predictions coming out of the University of Washington and Johns Hopkins, which honestly paint a pretty gloomy picture between now and the 1st of December as far as new cases and increase in deaths. And as Candace said, that peak in August really stressed all of us considerably. And we did have days where we had no available ICU beds at Grady, and the state was a great partner in standing up the alternate site at the Georgia World Congress Center. And that location was utilized from hospitals from Valdosta to Gainesville and everywhere in between. That wasn't just a Grady operation. And so if this next wave materializes as some of these projections are saying, their projections are a higher hospitalization rate than we just saw in August. And so, yes, indeed, we will have to continue to coordinate. And even if we don't see that, we will, because this is not going to be a short ride. We're going to be dealing with COVID and treatment of COVID along with everything else we do for probably the most of next year at least. And as Candace and I were discussing before we got on the call, we operate the 2 largest trauma centers in the area, and we've seen a tremendous increase in trauma during this period of time. Our trauma volumes at Grady are the highest they've been in the 10 years I've been here, and it's a combination of violent crime that's increased, as well as medical conditions and trauma related to people just being frustrated and tired of being locked up. So increases in motor vehicle accidents and in violent crime as well.
Carol, I'm sure you're looking at the short term and the long term as well in terms of preparation. I mean, what are your thoughts going forward for your hospital and for this conversation among your peers here?
Well, you were talking earlier about how the message may have changed in our communities, and I don't think our message has changed. What we are doing is trying to maybe position it a little differently, because we were taking a very active role in communicating with our local community. And early on it was shelter in place, shelter in place, shelter in place. Well, we reached a point where obviously that's what, even though we weren't saying that, that's how the community was hearing it when we were saying, we've got to do better. So we have created a community coalition that has a neutral chair, and it has our school systems, our city, our county, all of the various constituencies, the chamber that are around the table. And so we're presenting a unified voice. And you mentioned about the flu. That's what we're active right now. It's not only just the 3 W's, but it's the flu vaccine as well, and trying to educate people that it's not just that we don't want you to get COVID or to get flu. We were close to capacity before March the 12th. And so now to think about what we might be facing, we really are stressing, that message to the community. As John pointed out, we were fortunate to have a mobile unit that was supplied by the state, and that has given us 20 additional beds that we didn't have before. I would also comment in talking about how we worked with the state. Their willingness to offer staffing to us, both in the way of critical care nursing and critical care physicians, really helped us in some critical areas as our staff was getting sick, getting burned out, and I just can't say enough about that.
Candace, as you look ahead to the flu season, but also this collaboration, how do you see this playing out in the months ahead?
I see us continuing to work together. You know, one of the things that we're looking at, and Carol and John have mentioned this, through our Center for Health Equity, we continue to see our at-risk populations. If you're not, you got to be very intentional about the communication, because you need them to come in to get care when they need care. Okay, and there's a fear factor, and there's many elements on that. So as we move into this, the outlook ahead with the flu, with the continued COVID, we still need people to get in and get their healthcare needs met, especially for cardiac issues, neuro, strokes and that. But we did have a lot of people delaying care and avoiding care. And we saw this in our at-risk populations. And we really have to be very intentional about letting people know it's safe. Come in when to get your care, because that's, I think, attributing to this higher acuity. So we're going to need to work very carefully together. And if we can keep that, decrease the virus spread, it will help us have the healthcare capacity when our community needs it, not only for their COVID needs or for the flu, but also for their other vital healthcare needs. And then we've got to work on getting our whole community to get the care they need when they need it. And so that's where a lot of our efforts are right now. So same messaging, same cooperation, but we have to continue to tailor it to some of our new learnings and some of the areas that we think need amplification.
Any other thoughts from as we go ahead? I know we all in the healthcare community here in North Georgia are very thankful for your work and all the workers, all the nurses and doctors and techs and everything. And we're thankful that you all are out there and with the same message, and we really appreciate it.
I would just say that, to your point on that, Andy, our people, they keep coming back every day. They're there to take care of the patients in our community. It's so inspiring, and that's who we serve. So their well-being is a top priority for us as we continue to support them, as they deal with their parenting needs, as they deal with their taking care of their elderly parents and their other life needs. So we try to put as much support in place for them as possible. So keep them in your thoughts and prayers, because they keep showing up, and they are so vital to what we do. So I'm grateful to our people, and we couldn't do it without them.
Well, we're grateful for all of your leadership, all three of you, and for the other systems that have cooperated and working so hard, and all those healthcare workers. We at Health Connect South appreciate you all being on the panel. It was great, and I learned a lot, and I'm sure all our listeners did too. Thank you. Thank you for your time.
Thank you.
Thank you.
Carol and John. Thank you, Andy.
Thank you, Candace, John.